So today we'd like to ask you certain questions, given that you are actively involved in research as a clinician. We'd like to ask certain questions that the students have raised to get to know more about the whys and the hows of research, what goes on behind research, what goes on behind the findings of research. Um, okay, so moving on to the questions. Ma'am, firstly, we'd like to know about what motivated you to take up obstetrics and gynecology, and was there any particular moment or any mentor who motivated you to take this field?
Interesting question. So basically, I'm a surgeon by my, I think it's by birth, because I always want to do something surgical. And so from my year one, I have always wanted to do, I liked anatomy a lot more than biochem. And am
Mhm.
I audible? Sorry, I all seem to be
Yes, ma'am.
frozen a bit.
Yes, ma'am. Yes, ma'am.
So
You're audible.
I was very clear from the outset that what I didn't want to do. I didn't want to do anything medical. That was very
Mhm.
clear. And in my career, when we finished our MBBS, we get to serve in remote places and mission hospitals, if you've heard of. They are situated in remote areas across India. And I was serving at one such hospital in Madhya Pradesh, which serves the Adivasi tribes called the Gond tribes. And there, what the hospital that I worked in had a lot of surgeons actually. Since my field of interest was surgery, when I had to take kind of a sponsorship, I asked them if I can do something surgical, and they said I have to take up obstetrics and gynae. So I personally was not very interested in obstetrics and gynae to start with, but because the administration asked me to do it and it involved a lot of surgery, I agreed. I spent about 18 months there and then an 18 months in another hospital. During most of that time, I practiced only obstetrics for 3 years. Following which, I applied for those days we could write for what is called a special paper in obstetrics and gynecology. And for 4 months, I prepared just only reading Williams Obstetrics and Novak's Gynecology. I finished reading it before writing my entrance exam for obstetrics and gynae because that was 4 focus months, or we didn't have to write a neat like a full paper AIPMT or the days that we wrote. It was, I think, all India postgraduate medical entrance. And so I could actually write a focused OG paper, and I got in on first attempt for diploma first, and then went on to do MD, which was 2 years, so 4 years of OG. So that is where how my OG story is called Padar Hospital in Madhya Pradesh, and I did go back in 2003. For the next 36 months and odd, I served my obligation there, and that is where I actually developed my interest in oncology. So I fell in love with my subject during my bond period from my undergraduate. So we call that an obligation as a bond, for those of you who are not familiar. So 3 years before PG and 3 years after PG, by the time I worked with the specialty, I really loved the subject and took it up. And my oncology interests also were born there. And so,
Okay, ma'am.
inspiration wise,
Uh,
if you ask me, yes, there were a couple of senior people who inspired me. The one particular person was in house was one Dr. Padmini Jasper, who some of you may be knowing, and the one person back at the Bond place was one Dr. Meenakshi Solomon. So it's very important to have good mentors who practice evidence-based medicine and encourage you in your early days, giving you a free hand. So that was my initial days.
Ma'am, since you've spoken about the importance of mentors, I would like to ask you how you manage your bedside work along with teaching and your research.
So when we came back
So
to
how do
CMC
you?
in 2000, yeah, sorry.
No, ma'am, that was the question. How do you manage all three aspects of your life?
Yeah, so when I decided to move back to CMC in 2006, the motto of the institution says we have to do all three: education, service, and research. And if you see that, education comes first. So we are primarily teachers to our students, interns, PGs, and postgraduates. And now I'm teaching fellows. So education is like the first word in the mission statement. The service comes immediately after that. Research is an equal wing of it. So they encourage us. So how do we manage is that when you're in your early days, when you're the juniors and doing the foot soldier work, it's very difficult to get. You don't manage your time. Actually, your time is being managed by your seniors. So I would max make the times on, let's say, the weekends when I'm not on call on Saturdays or maybe afternoons of Sunday. You would have to compromise a little bit of your afternoon sleep and catch up on all that you wanted to do in research. Having said that, we because I was in a teaching institute, there were opportunities to present, to read, to receive information, and to imbibe. And research ideas were bought during the working hours because it's a teaching institute. They used to have seminars, they used to have talks, they used to have paper readings, which we were also encouraged to present. And so, research and evidence-based medicine was integrated and giving us opportunities. And each one of us had to take up a topic and work on it. So we were encouraged and mentored into doing that. And they would give us, suppose we have deadline, we have to present a paper somewhere, we were given protected time close up to the deadlines where we had to submit. So it's a lot of collaboration and cooperation with your seniors that makes the impact for the juniors. Yeah.
One question that was brought up was if there are strict deadlines, particularly when research is being integrated into this system, do you find that it could sometime possibly compromise on patient care?
So the way we work, suppose I have a team of 10 people, I give 5 people an opportunity at one time and 5 people opportunity at the next time. So suppose this conference or this academic event, a certain number of people have to attend. The work is being carried on by the remainder five. So it never goes compromised. The protected time is encouraged when there are deadlines and they take turns. So everybody gets a due course of their time when they need it. And we mark
That's
this out much early. So 6 months ahead, we plan these activities so that it's not a rush bush and a last minute thing, which affects that day's work or that day's thing. So they are given some time off much ahead.
okay. Ma'am, so you say that the research ideas are bought because in a teaching institute, the research ideas usually come to you with a lot of presentations and talks. So, how do we make sure that what research that we do remains clinically relevant and not just purely academic?
Okay. One interesting thing is I, for one, love writing and taking exams. You may have understood I've probably written a lot of entrances to even get into my MD. I wrote 2 entrances and then I just took the DNB because I want to study. I like exams. So why I'm telling you that is when you write an exam, you actually spend time in reading. And when you're reading, even when you're reading for your exams, you read things which are, the textbooks give you ideas when you read the small print. So I had my small book of ideas which I would note down. Okay, this is a possible research area. So you have to do a lot of reading by yourself with a calm mind. That's what I was saying. And sort of as you go up in your careers, when you're becoming medical students, you want to stick to basic textbooks. But I have seen when I was teaching undergrad, there are some children who would, if suppose it's UTI in pregnancy, I had a student who once had gone up to the extent of referring, let's say, Harrison Book of Internal Medicine and referring and making those extra points. So it's almost always self-driven, your interest to think of new ideas and keep attending. It is never a forced thing. Sometimes for our promotions, we need to do a forced publication. But when you enjoy and appreciate the subject and start thinking, why not this way, why not that way, and then research ideas are born. And it only gets added when you go and read, okay, so has somebody done something like this? Then you read other papers, other people's ideas, and then you said, okay, there's very little information, why don't I do it in my population? So that's how you get a research idea born. And it's a lot of reading which you have to do out of what is required as mandatory. Yeah.
Ma'am, as a senior professor, what would you recommend that someone in an undergraduate level do while approaching research in obs gynae? Particularly, how to approach professors, what sort of work has to be done before, how do they approach deadlines to accommodate the professor's needs, anything that a professor would in general expect from a student?
Okay, that's a bit of a trick question. As in, sometimes there are two ways to look at it. One is the professor themselves have a lot of ideas and they want people who are eager to take it up, especially like the basic sciences one. If you we may be the clinician behind, but if we want some basic research done by, let's say, a biochemist or a physiotherapist, we give them the idea, or anatomy, we give them the ideas, but we will not able to give them personnel, and they are now looking for people at a junior level who can do the bench work and the basics. So we have some ideas, some projects, people already integrated, and we are looking for work people. That is one way of the research topics being given out to the obstetrics. Sorry, I'm talking about the medical student. The other way around is when you yourself are interested and you read and you come and say, ma'am, I want to do a project with you. And then you say, okay, now throw me some ideas. Have you thought of something? So it's always good to go prepared to the professor. Ma'am, I have, because you are not, especially things when you're applying for, let's say, studentship or something under the Indian government program. So you should have a program or a sort of a idea which field. Okay, ma'am is in oncology, I'll do something in oncology, I'll do some basic research in that. So some sort of reading into the thing subject helps for the student, and then you are able to complete the whole thing, like I feel.
So what type of research would you suggest that an undergraduate take up so that it's easier for them to manage academics as well as research, as well as extracurriculars in their student life?
Again, I would say that depends a lot on the student's perception, because some people love doing basic science related research. Basic sciences research is really actually fantastic if you have a commitment which goes beyond your uh, personal, time management. It's really, really important, and you know that you have to compromise some of your like the pleasureful activities or going for a movie or something like that with your friends. There's a lot of special time required to do basic science research. But there are some people who are focused onto that, and I would encourage such people. But if you are thinking about managing everything together, clinical studies are definitely easier. You only have to be like very focused on finishing the deadlines. They're easy to write, easy to finish within your clinical period, because there's a lot of gap time between your classes and actual, let's say, case discussions by seniors, or the evenings when there's no cases happening. There's a lot of time. And with the all the social media and everything now, this Google form and everything, if you consent and do it properly, get your IRB cleared well, then it's easy to do a clinical study. So both are actually okay. It all depends on your avidness and your interest in the field. Yeah.
Ma'am, we just wanted to ask, is it possible or how feasible is writing a case report for a medical student? Or is it something that a PG student is more motivated to do? What is your opinion on that?
Well, case reports is a good way to start any research life. I think if you look at all the senior professors' curriculum writing, you will see that we all started off by writing a case, and in those days we could even write a letter to the editor on a particular journal and as a commentary. So it's good to write. But I also encourage starting people to write cases, because you get a idea as to how to present. The format is a little different from case series, but at least you learn how to archive literature, store them, insert them. So the methodology, and it's a small project. So it's a very good start project, and I appreciate it if students come to ask for case reports. It's a good start. It's not only
Um,
PG level. I think you all can do
okay.
it.
Yes, Bob.
Mm.
So following all the data collection, can you let us know a little bit about what happens after we have done with data collection, maybe even after writing one draft of the manuscript, a little bit more on what happens after that?
Okay, so basically nowadays I think there are various ways you can collect the data, and most researchers, if they're doing sensible research, we like to have a what we call a live platform. As in, if you take, let's say, Microsoft, you can use the Excel workbook and keep entering on your data on that. And it's a common thing. If you share the link, let's say I'm doing a project with you, then I have a platform where I can share the. You can keep putting the data, and I can keep monitoring. It's a very good platform which I encourage my colleagues to do it. But the easier ones probably are the red cap, which is very user friendly, and most people there also it is a dynamic one. So first of all, we have to be useful. You get used to red cap. It's very useful one. We can monitor your progress through that, and of course the SPSS data collection sheet is also there. So that is about collecting the data, and it's very very important that that the data is clean and doesn't have too many blanks. Every column, if you should have a way of saying that I don't have the data is equal to 99 or something. So every column should be accounted for, every box, or if that is done, then your analysis becomes easier. So the method we do is first we get the IRB clearance, then we have this document where you collect the data, which is called a tool, or you make a questionnaire, whichever suits you, either RedCap or AP Info or Excel or SPS. Make all the components, drop down boxes, and get it ready. Then you approach your data set. As you collect the data, keep completing them. And then end of the data collection, clean the data, see for all the empty boxes, nicely clean up the data, because that makes it easier for the statistician. Then you submit it for your analysis. And after the analysis, output comes from the you have to feed the information to the statistician, asking them, so these are my things, these are my aims, these are my objectives, and these are my variables, can you give me the output? So then they will throw back the output to you, and then you have to make sense of what they've said. Is it true what they're saying? So it's not all about just interpreting numbers and p values, and it may be nonsense sometimes. So if you do not feed the right data, they say no, garbage in, garbage out. So you have to be very careful what you tell the statistician and interpret it along with your senior. And once that is done, then you can put it into a manuscript, putting all the aims, objectives, results, and then discussion and conclusion. Of course, the reference insertions come in between, and that is a separate topic by itself, how you work on that, the manuscript preparation.
Ma'am, can you let us know a little bit more about submitting manuscripts for different journals? How, if at all, they're asking for corrections, or if our manuscript is being rejected? A little bit about that aspect.
Well, there is no particular methodology of doing it. First and foremost, we have to have a good language control. We have to write it in the way. So first, I tell my juniors, when you're going to write a journal article, you first look which journal you're writing to, because each journal has a way of writing it. And when you do write that, you have to do it in the particular way that they want it. Once you write it, the aims, the objectives, and all that correctly, and you submit it, then you were asking me how do you do the corrections? Is that what you wanted to know? So the review, they send it to say 3 reviewers. Each reviewer will give their comments, and you have to answer each reviewer's comments and mark the changes. Then resubmit it in the portal that you have submitted, online submission. Then the reviewers are invited to review the changes and accept or reject or advise modification. So that is the process it goes through. And then we say accept with minor, or reject as has major faults. Language is an issue. So most common, the rejection is a language issue itself. So that is why I'm saying it's important to vet the language, get it seen by some professional people. Like we in our institute, we have some scholars who go through our articles. In your institutes, if you have a research office who can see the language corrections and give. It's not like we know spoken English, but when we want it written, the language the journal wants, especially those the Western journals, they really are particular about the languages. So that's about accepting and revising changes, and it's a little bit laborious process time. Each time you submit, you have to build one. The computer itself or the system itself will tell you you have to build a PDF, you have to view it, and then you have to approve it, and then say submit. So it will make an article like how you read, like that it will prepare it, and then you have to submit it. So all of that is there now. Online submission is so easy, like actually. Yeah.
Ma'am, with your experience, you would have certainly attended conferences where you would have had talks or presented your research. You would have been judges for various events. So,
Mhm.
what do these judges look for? How do we present our papers? How do we present our research? And yeah, essentially, how do we sell the research in a conference setup?
Yeah. So a lot depends on who's your audience. Number one. Okay. So you can't.
Ma'am, in this group, we have UG students as well as PGs.
Yeah.
So I understand the audience for both of these groups will be different. So if you can explain for each group individually, it'll be really useful for us.
No, I was meaning the audience was listening to your research. So if so if you're an undergraduate student and you're presenting a research, the way the judges will look at it also, they know that this is undergraduate research. Having said that, they're looking for the novelty and your input into it. Is it somebody's work that you're presenting? Have you understood the concept? Because this is starting level research. And are you presenting, just because you want to present, or you have really worked into it? So the aims, objectives, and the way you have carried out the research can be questioned into. So especially if it is basic science research, they will ask you the exact method you've done, and they may go into the details of the technology or you used, maybe ISC staining or something, real details. It may not be exactly what you're presenting. They can dwell deeper just to check whether you have understood the part of it. When it comes and they're quite nice, they encourage you, they're usually appreciative, but you have to have clarity of thought about your project. Be crisp and clear and short, but understand the work. Never go with somebody's gift authored, like even if it's a senior saying okay go and present, you always try to understand it before going. That goes to say for both the groups, but mostly for postgraduates it's your own work that's encouraged, and much appreciation is given for again originality of the idea and the newness in the concept in the field that you're presenting. So a lot is looked into that. The that kind of carries the weightage, and the catch is the heading actually, how you put it across. A lot of the times I've seen the winning topics are the ones who have a good title. So title plays an important role when you submit a research, and then presenting elusively the aims and objectives and how you did the research is very. And having said that, we all understand prospective data always carries weightage, retrospective data much lesser. So if you are planning ahead and doing a good prospective, of course randomized trials are the best. That is little difficult, but anything prospective is appreciated, right? Big or small. Yeah.
Okay, ma'am. So some of the questions that we are receiving as we speak is, what challenges did you face in choosing your study design?
Yeah, and the study design, it's like now I'm for the last 15 years I'm into oncology. From that perspective, it's mainly the follow up. And how will I get the full follow up group? When you plan shorter interventional trials, it's easier to if you have the specified time period, you can ensure the follow up. But long periods, when you have like pregnancy and the outcomes are so there, when you plan something, you can easily execute it. Gynae may be a little difficult, but when it comes to oncology, it's even more difficult. Reproductive medicine may be medium between the two. So it really depends on the topic that you're working on. So that will help you decide. RCTs are really the way to go forward. Whether small or big, your concept and your thinking should be there. But executing those may be a little bit difficult. So when we switch to those kind of follow-up related problems, we go on to minor interventions. Let's say I do a certain surgery a little differently, or I assess a person in a different way, or I test the patient in a different way, or do a pathology test which is a little different, and then I have short term period that I can follow up. So choosing the design depends on who you are studying. That is what I was trying to say. And the difficulties are in the follow up mainly. It's not about us and our time management, right?
Yes, ma'am. So, of all the different types of studies, which do you think has the greatest impact on patient care?
Um, I mean, I don't know if you got a chance to look what I've been working on all these years. So I'm saying the retrospective data is not actually useless. People may say, but we learn a lot. It's a sort of an audit about what we've done, and it's a study about our own patients. So retrospective studies do carry value. We can, at least in the earlier parts of your research, do some of those to get a hang of how you look at patient data. Then you will realize what is the pitfalls. Then, like I was saying, follow up is a problem. So you will establish systems in your future prospective studies to ensure a better follow up. So I feel that doing the retrospective studies, you can learn a lot, then go on to prospective studies, and then on to randomized trial. You can straight go to a randomized trial, that also is fine. Having said that, I would encourage all of you young minds to even look into early into writing systematic reviews on topics that are controversial, or do a Cochrane analysis. These are the things which require a lot of inputs, and I have worked with some youngsters who are really brilliant. So it's a challenge that I would leave out there to you, that you should try and do those studies also. It's not only about clinical studies straight away on patient. Patient data is very useful in learning things for future and for making policies and your own practice changes. All of the studies are important. Yeah.
Ma'am, during our talk, you had mentioned sensible studies. So, how does one assess if something is sensible study or if it isn't really contributing as productively as one would hope?
Sensible, as in you mean to say which makes clinical relevance to the patient. Yeah. Uh, I wouldn't, sensible as in it shouldn't be like, just assess some blood loss and something that can be a clinical audit. Sensible is something which the end of the study you get a result that is going to do a practice change, a small understanding. You would have heard your professor say, we studied this, and because we found this in our population, we have changed the practice. For an example, I can say like removal of the catheter after, say, a radical hysterectomy. Okay, so we did a randomized trial on that, and then we said, okay, now we know that early removal and delayed removal really don't make a difference. And so we had studied it. Is it so that the denervation happens, or prolonged catheterization will lead to a atonic bladder? It wasn't so. So everything that you do, an intervention or an observation, it should have a clinical implication. That is what I meant by sensible study. Just putting together some data, and I saw 50 patients, they had this diagnosis, they had the percentages, and there's some 30% survived. We haven't learned anything. Maybe we know that we saw this many patients. It's just like a history account. uh, and again, I wouldn't call that as totally useful, some information, but it's not of much practice change. It doesn't change anything to the patient. So I would encourage you all to do studies which makes a difference in way we look at patients, way we treat patients, rather than just historical capture of data and say, this is what it was there, and these many patients I treated, and this is my results. Like a audit report is not so welcome. Audits are good for quality check. That's what I would say.
Uh, okay. Ma'am, another question that we received was how do you Oh, is it? I think it's raining a bit in my place, so could be because of that.
We
Um,
do have
Ma'am, can you hear me
rain.
now?
Yes, I can.
Sure, your study maintains both internal and external validity.
Well, internal and external validity, as in relevance to what you're doing, and relevance in comparison to the research outside. Uh, you can. You must again ask me at which level. Now, for the undergrad, it's up to the seniors to match that for them. But for the postgraduates, it's much expected that you take charge of all of that when you do the research. And I guess your guides will help you to match up those criteria. I'm exactly not very familiar with this particular term that you said, so probably I will pass that on.
Okay, ma'am. Another question that we've received is what strategies have you found are effective for recruiting and retaining participants in follow-up and longitudinal OBGYN studies?
Yeah. So sometimes that is a very, very good question, because a lot of times they talk about incentivizing a follow up. So for example, we were recently involved with a vaccine study, and for that vaccine study, the participants were given their travel fare and some extra money for their snacks. They were looking forward to that incentive. So it's not totally unethical, because they are coming out of their time to take part in that study, and they need the travel and they need to eat the meal also. But they take it as a, like, they can use it how they want, and they do come for that also. But that's not really what we encourage. So what we should be doing is, I suggest is that you probably have a good database of their phone contacts, the contact details, the phone numbers, the emails, and the alternate contacts, and then have a system where they get an automated message where if they've not turned up. So set it up on your like a dashboard. When is the next follow up visit? And we have to follow it up exactly 3 months later. Call them up and say, look, you haven't come, what is the issue? So we can set these things nowadays with programs that are there already. So that is you have to remind yourself first that your patient has to come, then you have to call up the patient. So it is a system. And a lot of us working in academic institutes like this, we have a set of people to do that. We have a social worker, we have a nurse who can actually do the follow up for us. So we use the system itself. Individual researchers may have to set up their own protocols to have timed follow up. Main thing is establishing a good contact number, because lost to follow up mainly is not contactable. That is the commonest, problem when we say patients are not contactable. That's why there's no follow up, right?
So since you're talking about contacting people, I just want to touch upon the recent or emerging technologies like using telemedicine. Have you seen that being put into use in research personally, or have you read about it? And how do you think that's going to impact research in the future?
Uh, It's a very interesting concept which became very popular during COVID, and people didn't want to come in front, but they were happy to take a call and say they're all right or they have some particular problem. And so a lot of people are actually looking into that, and I do agree that it is the way forward. If you cannot come for a personal visit, at least you can have a teleconsult. I don't have much experience doing it in the research platform, but I have done it for clinical work, and it's very useful, and I think it should be useful for research too.
Ma'am, so from your research experience, what do you think are going to be the biggest, where do you think the scope is for research in future?
I'll be biased there. I'll definitely say oncology. But other than oncology, I think it's molecular medicine that is really the way forward. So now everything is customized, and it is a tailor-made and patient individualized treatment, if I may use the word, in any field, in any sphere, head to toe. And in gynae, ONG, especially, that all of the cancers have now molecular medicine integrated into their staging, as well as into the management issues. So the adjuvants are all driven through the molecular staging, molecular profiling of the tumors. Apart from molecular, the genetics also has now come into big play. So these two have really driven research a long way. So if you come to obstetrics also, I think genetics has a big role. Now they're a lot into prenatal diagnostics. My colleagues here in CMC are a lot of work they're doing in the fetal maternal specialty along with the genetic specialists. So equal importance to both obstetrics and oncology here. And reproductive specialists are also doing pre-implantation diagnostics. So a lot of the microscopic, that level work is what is going to be the future, where we can alter the way forward. Clinical medicine will have to lean on to these understandings, so that we are even surgeons are going to be asked to operate less and less. If, for example, immunotherapy has come a long way in oncology, and that's really open the arena. It's a huge platform which is making us shake in our knees, because surgeons are going to be out of job. Everybody is going to go the immuno way. So that's the fascinating way forward in most of obstetrics and gynecology, molecular medicine and genetic profiling of everything that you work with, whichever field you are interested in. Yeah,
So
and a lot of
round yes, yes.
yeah.
Rounding back to how we do research itself, you did say that a lot of reading has to be done from the researcher's side, be it undergraduate or PG level. So when
Mhm.
someone is reading and they come across a rather broad concept, how do we then narrow it down into
Mhm.
specific testable hypothesis that we can actually do a research on?
Yeah, so there must be some interest with which we are reading that particular topic, right? And you won't know whether it is achievable or not, especially if you're undergrad. It's very difficult to assess if you know this is doable or not. So you gather some thoughts which you have, make some notes, put them down, and then you approach a senior who you think you're comfortable to work with, or they are working in the field that you are familiar with. And then you approach them and ask, "This is some ideas, sir. Is it doable or not?" It's easier when you are a postgraduate, because you have certain experience of reading into, and you have read more than an undergraduate, because they are reading too many subjects superficially, whereas you're into your field and you're reading the textbooks which quote during the. So a lot of things, the ideas are born as you read. You'll see that this study said this, then you should question it. Why did it say so? What is the reference? So a lot of times, the research ideas that came from me is when I go and did the cross reference. So often the numbers are just numbers by the text. We never go and read what they are. But if you are intrigued by about some statement that thing has made, then go and read the reference statement, and from there, that reference will lead you to another reference. So an idea is born and it grows, and then you know which is doable, which is your liking, and you can jot down some lineage of things, and then discuss it with a mentor who will take it forward with you.
Okay, ma'am. So, what are the biggest mistakes that you have seen UGs and PGs make when they take up research? Anything that many people have, any mistake that many students have recurrently committed, or things that a student can avoid, be it in UG or PG level?
So a lot of times, when they want to do research, they are very avid. They come up, they sit with you, write the RB, they get it passed. All that is very good, because they're all deadlines, and there is this date you have to submit it, and so that all happens. Once it's IRB cleared, institutional review board cleared, when it comes down to the executing and following up and finishing the data, I find a lot of labs there only. So they're very loose at that. And then when the deadline is arriving, there's a big rush to just finish the numbers somehow. So I feel that sensible research then falls through the cracks, because we haven't committed a good amount of time to collecting data and entering it. So that is why I said the data set that you. So often when I have to go through research, I will ask my fellow or my PG, send me your data sheet. And then I will see some scribbles of paper, and it's not even in a formal database. So I think the data collection time, they kind of become slack. The conceptualization, the passing of the project is good. Getting the funding is good. The lapse comes between when you have to collect the data and then document it. Because after that, it's only analysis and output. And the next lapse comes when you have to write a manuscript. Okay, you may finish your PG, you may finish your submit your thesis, you may finish your concept or presentation or, and then it just sits in the cold storage. until your mentor asks, hey, what happened to our paper? So I think that the flow of events is the blocks are one is doing the study itself, the collection of data, and second is when you have to do out the manuscript. Two big time stagnant stuff. That's the two areas that I find often my fellows lacking. Yeah.
Talking about the manuscript, ma'am, once we're done with that, how do we choose which journal to submit to? Like, what do we need to prioritize? Is it the impact factor or the audience or what aligns with our topic? How do we go on to choose the journal that we want to submit to?
Yeah. It's a good question because all of us know that we want to submit our work to some good journal, and good journal goes by the impact factor. But that's everybody's dream. At the starting point, you're not even in a position to say which journal is my article accepted. And for most publication requirements, I think in most colleges it is mandatory that it has to be a series of cases, like original research that is preferred, and that also has to go into a like either a national journal, like if it is obstetrics and gynae, at least a national. So that starting point itself specifies it has to be a national journal. For example, Journal of Obstetrics and Gynecology India. So only that is considered your level. Anything below and etc. becomes kind of okay. You can apply there if you don't get it through at least this level. So the benchmark for submission starts with the highest first. So if you have a good research and you want to go global, that is the best way. So start with international journals, and then it will get through a round of, straight away they'll tell you, oh, some problems are there. Some may come back with some criticism. Then you can go down the rank. So always aim for the best journals, then come downward. Don't start with, I want my work accepted, I'll put it to the journal which I think I will get it in. Don't start with that attitude. All the work we do with research is very good. So in your field, suppose it's urogynecology, look for the good journals in urogynecology and try to look into the articles and the type of articles. If it's very basic science and they're encouraging basic science, yeah, please put your basic science paper in that. But if you think it's a very clinical journal, then you know that this is clinical medicine and I want to give it a shot there. If it's investigative journal, there are many investigative journals where they look at only all transvaginal ultrasound or some scan related things or procedure related things. So you have to choose the journal according to which area you're working in. That is number one. Number two is you aim for the highest impact factor, which is good. Then you keep going down. Never let your ideas be belittled. And if it's a good research, you should aim for the highest possible. Then keep coming down. That's how we go through.
Ma'am, on a more personal note, have you faced any ethical dilemmas given that you're working with reproductive and maternal research? And has there been any research where what you hypothesized and what you found were exactly contradicting? How did you go about, like, is there any instance in your research, something that came up?
Okay, that's a good question. So when we started doing PG, I was doing a thesis on, let's say, transvaginal scan in pregnant previous cesarean scar. Okay, it was being studied. This is about 20 plus years before. It was being studied by some, and they were saying the thinning of the scar is relevant. And, so there I would study a scar, and I know that scar is thin. And this was during my study period. But I would be asked to start a Pitocin because that's the protocol we're inducing. But I know in the heart of hearts it's going to go for a failed, and I'd be very scared whether it'll be rupturing because the scar thickness is. I knew the findings and I'm giving the trial. So that kind of ethical issues I did face. And also when I even presented that concept, it wasn't a very like fanciful idea. So I was told straight off, no, you can't publish this. This is not going to be relevant. So that was another like setback I had. Some of us seniors can be that daunting also, that you do not let us go forward. But by God's grace, I could complete the numbers even if it was later, and I managed to publish. So ethical issues you will face sometimes directly as what I mentioned, or some in a way that it's not so direct, but you're being pressured into doing something which you may not think is right. So you'll have to take a personal call. So in the case, for example, I had a patient who has a thin scar. I was extra cautious. I was by her side, make sure that she's all right, and I would do things which are needed for her, like that.
Um, Ma'am, looking back, what do you think is the
Yes.
most defining project of your career?
Okay, so about 5 years back, I was working with a fellow on a project called the molecular mapping of endometrial cancers. Endometrial cancers are now more mapped according to their P53 status and their something called the pole domain, like polyepsilon domain mutation, as well as the microsatellite instability, which we do through simple immunohistochemistry, looking for those four deficient proteins. So it is something doable, very cheap, and very at our lab. Pole E was not being done at that time. So we got our molecular pathologist involved, and we together we said, okay, we'll try and do a research on it, and we archived some blocks and we did it, and with that we could establish the pole E testing in our institution. Soon after that, the endometrial cancer staging actually changed in 2023. This was following our publication in about 22, I think. So it was very exciting that something which we were working on has actually become a practice change. And now, and in CMC, we're doing molecular staging for everybody. Poly is only done with some people where it is possible. So sometimes the research you do and it leads up. So now one of our colleagues is doing a research on HPV prevalence in serum, like circulating tumor DNA. We're doing research with circulating tumor DNA in both ovarian cancers and in cervical cancer. And we're really looking forward to the monitoring of these cancers, not only by just biomarkers and imaging, but by the patient's own response in terms of how they're mounting a response and how much of the DNA is present in the blood, how much of it is getting down as we treat the patient. So, really exciting avenues that we are exploring. So, the one thing that really excited me was the molecular staging of endometrium, and it's been very an exciting journey, and it's become part of the staging now. So it's really exciting for me. Yeah.
Ma'am, since you've said this, is there any challenge or any barrier that you face um, in translating your research findings into a policy that is going to change women's health, essentially? So, what are the
Absolutely,
barriers that you
bang on.
change?
The biggest barrier was something, of course, that we all agree. So we did write for some DST grants and ICMR grants to roll it out on a larger platform. And then we worked with our lab to bring down the cost so that we can test more frequently. So from research to practice, the main problem is it's a new concept, it costs money, and then to roll it out to make the patient pay for the things was little difficult. Similarly, if you can see with robotics, right? Robotics is there, but we cannot use it for the patient because it's expensive. Whereas if it is through a research and somebody is funding that research, who will not say no to a surgery? So funding is a big, big problem in research, if I may point that out. Yeah.
Ma'am, another question is how do you keep yourself motivated during the long and the slow phases of research? Um, Apart from determination that researcher must have, is there anything that keeps you motivated?
Well, so when I'm waiting for one research to finish, I go on to another one. So I keep working on different phases of multiple researches. That keeps me busy, and background, the other one is going on. And because I have people with me, who the juniors who are doing, they carry on the research. But at your level, you only have one, let's say one or two projects going, and your mentorship is really important. So, for example, I constantly stay in touch with my fellows and ask, okay, guys, how many patients have you recruited? How much time do you have? When are we meeting next? Have you done your review literature? Can you come with this? So, you have to be with your team member. Then it is helpful to be not bored. And you have to set goals. So you have your thesis submission date or your research submission date 3 months down the line. So minus 2 months give you some breathing way. You should stop collecting all the data so that you can refine and redo things what you want to do, and then take it forward for a effective analysis. So I feel it is a team effort. It's not an individual aspect. A lot depends on having good mentorship. So that is the thing.
Ma'am, when we are carrying out research with multiple team members, how do we ensure that the quality, the data quality is maintained?
Yeah, so I'm personally been involved with a single concept and a single person type of a research. When we have taken part in multicentric trials where it involves, let's say, somebody else is collecting the data and they're filing it in a electronic process. For the verification of the data, we do intermittent checks. We are given a job as the principal investigator. We do random checks of the data because every data has, let's say, a ID number. So even the fellows knows, as a rule, we ask the fellows to submit their data sheet, part of their clearance, to the office. So they know they cannot give rubbish because I'm going to go through that. Once it's a enforced thing through, so a very good institutional review board with its rules and regulations actually ensures that we submit good data. Sometimes if they find any irregularity, they also have safety more, especially when it's randomized trials and interventional trials. They do have safety monitoring boards which call for review to see what you're doing with your interventions and if there any safety issues, or with the respect to that time they'll check your data also, and you're supposed to submit your data for for a closer view and finer combing of what's what. So good checks in place actually enables us to get out good ethical entries into the data. Yeah.
Ma'am, what skill do you think that every aspiring physician come scientist in OBGYN must have or must master early on for a successful later period?
Sorry, I didn't get your question. First part I got missed.
Ma'am, what skill do you think is essential for an aspiring physician come scientist in the field of OBGYN that they must master early on?
For research?
Uh, to both conducting research as well as a clinician, ma'am.
Okay, this is particularly how to be a successful researcher being an OBGYN person. Well, it's a personal motivation first and foremost. You have to have that interest, and then you prioritize your time. Most of us are women. We have families. We have later life. We'll have children. We'll have commitments. So we can't say no to any of those. Even the men in our group may have the same challenges in other aspects. They may have families to look after. So family time, something that kind of robs you of good quality time that you would want to do research. So those of us who are not married may have other commitments. So your personal commitments sort of can delay your commitment to you. So you mark out a specific time of the day or the week. Like I earlier mentioned, I used to use my Saturday, Sundays to its maximum. So that's where I stole into their time. When they are not needing me, I would probably put my best efforts at research. Or a day when I'm not operating. For many times I've told my fellows, you have to have some part of the day which you call your time, which you can do activities which you want. So being disciplined and having a timetable every day and for every day of the week, it really helps to manage the balance. A lot of times when you're younger, because of duties and not sleeping and things like that, you may lose your focus. But if you have it in you that I have to finish, this is my deadline, then you will work around that. So setting goals, managing your time properly, and giving in to some small relaxations actually helps, if you ask me. Take good breaks. All these really matter in succeeding to finish your timelines and your research. Yeah.
There's another question. It has two parts to it. Beyond the citations, how do you assess how your publications have affected or impacted real world setup? And following that, how do you assess how your publication has affected a diverse setting, not just studies that would be or particularly targeting tertiary care centers? How do you think it's affecting diverse setups?
Yeah, so a lot of us are, when we are doing research, we are logged into, you must have heard of the ORCID, no? The ORCID ID, as they call it. And if you are logged into that network, it gives you a prompts as to where all your research is being cited and who all. So it's very interesting. For example, I once published an article on abdominal tuberculosis mimicking malignancy. Now, that is something very relevant for a wider group of people. It may be gastroenterologists who are dealing with SITs, or it may be a surgeon, it may be people practicing in the community setup where they could do a small test and be able to prove that this is only TB and not cancer, and put through the family through a lot of anxiety. So when I knew that there were a different type of clientele reading what article I wrote, it encouraged me. So it wasn't actually oncology, but it really meant that my work was being utilized by somebody to, and it was enlightening them as to what I meant by, how I can say this is TB and this is cancer. So the feedback that you get from the research system itself keeps motivating you. It's not how many citations is a next level of motivation, which I think you will reach there once you are doing sensible research. But it is important to focus what is my research going to. For example, I said about my molecular staging. It has resulted in something. So it's important what your research has impacted in. Is it a larger group? Is it some patients? Or are you in tandem with what is happening with the developing things in your own field? So I personally wouldn't say I would have a focus on how many citations I have, or how much is my impact factor. I only aim to do more and more and more wherever I can. That's how I push you all to encourage you all to do it. That will come, by the way. So that's how I'm saying it. Yeah.
Yes, ma'am, definitely. So again, a personal question. Who has influenced you the most? Like, is there any particular moment with your mentor that has influenced you so much in your research journey? Can you share one anecdote with us?
It was a personal challenge to myself that motivated me to do research. So there was, basically, I was not for research. I'd be very honest with you. But there was one point where I said, now I have to finish 5 papers in this given next 9 months. And these 5 topics I already was working on. Okay. So I put my focus and I wrote it. Once I finished those 5 papers, I realized, this is it. You can do it. So then you are motivated to do more and more. And it's not because I want to raise my CV number, publications and my CV. It was not that, but it was fueling me. I was feeling very positive about doing research. So it kind of gave me an interest. So I said, okay, why not study another topic like this? And I think because we sign up to present in academic meetings, that gives us an opportunity to showcase our work. So that is something I encourage. Take part in as many academic activities as possible, as participation, competitions. That motivates you to work towards something. You may not win everything, but you have presented. That is really important. And because you're going there on a platform where people are watching your work, you want to put your best foot forward and do a good research, and not, like you said, sensible research, and take it up there, right? So that was two things which I felt were changing in my life. I try to attend at least a minimum number of, say, 2 to 3 academic presentations, so that we can keep up with that minimum requirement of 3 papers a year, right?
Any final advice for us?
First of all, I'm really impressed that you all have such a group And I'm more impressed that medical students are part of this. Postgraduates, you two are in busy schedule. You all actually want to listen to some, uh, like I can't call it advice. You all are excellent children that you have actually sat down to do these kind of activities, which I don't think we did when we were your age. So I will appreciate each one of you being here and listening to what's being shared. So these are not really pearls of wisdom, as I call it, but more of an experience and my journey through research. So, and my own belief is it's not that you have to be brilliant to be a researcher. You just have to be committed, focused, and tie up with people. And if we show genuine interest, there are a lot of people who want to help us. They have ideas. So keep interacting with people who are related to your specialties, so who are related to what area of work you're doing, or something that interests you. Keep talking to people, and listen to this thing, and read journals when you're passing time, when you're preparing for exams, whatever, if it is undergrad also. My best pastime in the library when I was studying for my final MBBS also is like, I'll leave my books and I'll be reading all the journals and seeing what is new. So it's really nice that you read things which you may not understand now, but a seed is sowed in your mind, and later sometime that it gives you an idea. So keep reading avidly medical research. It really helps us and empowers us to do further research, apply for these national grants that are so much there, for students. So please take an opportunity and apply to all the studentships, and so many student grants are available, both Indian and international. And one more thing I really would advise is try and do some, visits to centers of excellence where they are carrying out research. Do some observerships in labs where you get some ideas and stimulated by what they're doing, so that some ideas are born for you to nurture and develop them. A lot of my work actually took many more multiple interests after my visits to some centers abroad. So anywhere, whichever lab or something which interests you, your area of interest, volunteer to go and observe and ask them, can we do some observership, or can we work as part-time in your lab? And then they appreciate your interest and join you on to the projects. So it is a lot of self-driven motivation. Stay focused and commit your time to do this. And wish you all the best for all the research you're doing. It will be nice if to know what kind of research. I probably have to Google and see what you all are doing as research. And I appreciate this forum, and all the best to all of you. Thank you for patiently listening.
Thank you so much for answering our questions, ma'am. To anyone in the audience, if you'd like to ask any question, any final questions, ma'am, please feel free to unmute and ask the question directly, or you can also drop in the question in the chat box. If there are no questions, we would really like to thank you so much for taking the time out of your busy schedule, no doubt, to come talk to us, give us useful insights that's going to help us, ma'am. Thank you so much, ma'am. We just want to appreciate you for the same.
Thank you for involving
Thank you,
me in
ma'am.
this.
Thank you, ma'am.
Bless
Thank
you.
you, ma'am.
Yeah. Thank you.
Um,
Bye bye.
to
Can
all
I
the
leave?
audience, yes, ma'am. Yes, ma'am. Thank you so much. Good night, ma'am.
And you want to say something? Sorry, go ahead.
To the audience, I will be sending a Google form right now. This is the post-event questionnaire to ask feedback, and it's also essential that you fill in this Google form in order to receive your certificates. So that will be the end of the event. Thank you so much for joining, ma'am.
Thank you. Thank you.
Thank you.